Hello and welcome back to the GCP-Mindset channel. Today we'll talk about strategies for LGBTQ inclusion in clinical research.
Welcome to the GCP-Mindset channel and all topics on clinical research.
In the realm of healthcare and medicine, LGBTQ inclusion is not just a matter of social justice, but a necessary step toward comprehensive and effective clinical research. The representation of diverse groups, including various sexual orientations and gender identities, is essential to understand the full spectrum of health outcomes across different populations. Yet, the LGBTQ community continues to face significant barriers in clinical trials, from discrimination to a lack of inclusive language, which can lead to disparities in healthcare. Acknowledging and addressing these challenges is crucial for enriching clinical research with diversity and precision that reflects the real world. This video delves into the importance of LGBTQ representation in clinical research, examining the multifaceted challenges that transgender and gender nonconforming individuals face in clinical trials. Strategies to increase LGBTQ participation will be explored, highlighting the role of healthcare providers and researchers in fostering an environment of inclusion. By emphasizing the adoption of inclusive language, the integration of diversity in clinical trial designs, and the mitigation of discrimination, we pave the way for a more inclusive approach to clinical research. Through these discussions, the article aims to provide a roadmap for enhancing LGBTQ inclusion, ensuring that clinical research is reflective of all facets of society. What is the importance of LGBTQ representation in clinical research? Historically, the LGBTQ community has been significantly underrepresented in clinical research, primarily because details about gender identity and sexual orientation were often not recorded. This lack of representation stems from a broader issue of mistrust towards the medical research community, fueled by past experiences of discrimination and stigmatization. The absence of LGBTQ individuals in research not only skews health data, but also prevents a comprehensive understanding of health outcomes across all demographics. Even today, many clinical trials and studies fail to include non-binary or comprehensive gender identity and sexual orientation options, maintaining a binary approach that does not reflect the true diversity of human experiences. This ongoing issue contributes to the continued underrepresentation or misrepresentation of LGBTQ individuals in health research, which can lead to significant disparities in healthcare and treatment efficacy. Efforts are being made to address these gaps. Initiatives like the All of Us research program have made strides towards inclusivity from the outset. With the support of organizations like PrideNet, this program is building one of the most diverse health datasets, which includes about 14% of participants who identify as LGBTQ. This inclusion allows for focused research on LGBTQ health issues and enables nuanced statistical analyses that consider multiple intersecting identities, such as the health experiences of individuals who are both transgender and African American. The data collected through inclusive research initiatives like All of Us not only enriches the understanding of LGBTQ health, but also encourages other researchers to explore these areas. The availability of such comprehensive datasets reduces the barriers to studying LGBTQ health, potentially leading to improved patient care and more tailored medical education. In conclusion, enhancing LGBTQ representation in clinical research is crucial for achieving equitable health outcomes and understanding the full spectrum of human health. By adopting more inclusive research practices, the medical community can ensure that all individuals, regardless of their gender identity or sexual orientation, are considered in the advancements of medical research and healthcare provision. What are the challenges faced by LGBTQ participants in clinical trials? Number 1, fear of discrimination. LGBTQ individuals frequently encounter discrimination within healthcare settings, which significantly deters their participation in clinical trials. Surveys reveal that a substantial number of LGBTQ people, particularly transgender and non-binary individuals, avoid medical care due to previous experiences of disrespect or discrimination by providers. This includes instances where providers have refused treatment or used inappropriate language, contributing to a pervasive fear of mistreatment among these communities. Number 2, limited access to care. Access to healthcare remains a critical challenge for LGBTQ individuals, exacerbated by a lack of providers who are knowledgeable and sensitive to their specific needs. Many healthcare professionals display limited experience in addressing the unique medical and emotional support requirements of the LGBTQ community, often leading to inadequate or substandard care. Additionally, economic barriers further restrict access with a significant portion of the LGBTQ community, particularly those who are young, reporting higher rates of part-time employment and lower income levels, which affect their ability to afford healthcare in some countries. Number 3, lack of inclusivity in study design. The design of clinical trials often fails to consider the diverse identities and experiences of the LGBTQ population. Traditional study protocols, consent forms, and data collection methods do not typically account for various gender identities and sexual orientations, thereby excluding significant demographic data that could inform health outcomes. Advocacy and changes in clinical research practices are essential to create more welcoming and inclusive environments that encourage participation from all sectors of the LGBTQ community. This includes the implementation of minor modifications in clinical protocols and the training of clinical staff to be more sensitive to the needs of LGBTQ individuals. But what are strategies to increase LGBTQ participation in clinical research? Number 1, involving advocacy groups. Advocacy groups play a crucial role in making clinical trials more inclusive for LGBTQ individuals. These organizations provide direct connections to the patient population, offering insights that are essential for eliminating bias from patient screening processes and ensuring that data collection methods accurately reflect diverse sexual orientations and gender identities. By engaging with advocacy groups, researchers can develop outreach and communication materials that resonate with the LGBTQ community, making clinical studies more accessible and appealing. Number 3, removing participation barriers. To effectively increase participation from the LGBTQ community, it is vital to address and remove various barriers. This includes revising clinical protocols and informed consent documents to be more inclusive of different gender identities and sexual orientations. Additionally, addressing financial barriers is crucial in some countries. Offering incentives such as transportation subsidies or providing gas cards can significantly enhance participation rates. Ensuring that recruitment materials and study designs reflect the diversity of the community also plays a key role in reducing hesitancy among potential participants. Number 3, building trust with participants. Building trust with LGBTQ participants is fundamental to increasing their involvement in clinical research. This can be achieved by training healthcare providers and clinical staff on the unique needs and health practices of the LGBTQ community. Moreover, creating a welcoming and educated environment in clinical settings is essential to make participants feel valued and respected. This includes using appropriate language, understanding pronoun preferences, and incorporating images that reflect gender diversity in recruitment materials. What is the role of healthcare providers and researchers? Number 1, education and training. Healthcare providers play a pivotal role in addressing health disparities among LGBTQ individuals, often stemming from a lack of cultural competence. Effective training programs are crucial, focusing on enhancing providers' knowledge, skills, attitudes, and behaviors towards LGBTQ affirmative practices. Despite the existence of numerous LGBTQ cultural competency trainings, their effectiveness varies, and there is a call for more rigorous, quantitatively evaluated training programs that include longitudinal assessments and patient-reported outcomes. Moreover, the educational needs extend beyond initial training. There is a significant demand for ongoing education about the healthcare needs and equity of care for LGBTQ populations among both students and established healthcare professionals. This suggests a need for training educators and healthcare leaders first to ensure they can competently teach and model inclusive practices. Number 2, creating welcoming environments. Creating a welcoming environment in healthcare settings begins with simple actions such as using inclusive language, displaying LGBTQ-friendly symbols, and implementing non-discrimination policies. These practices signal to LGBTQ patients that they are entering a safe and affirming space. Furthermore, healthcare facilities must consider the physical environment, such as offering gender-neutral restrooms and ensuring privacy in dressing and examination areas. Listening and reflecting the language choices of patients regarding their sexual orientation and gender identity is also crucial. This practice helps in building trust and encourages patients to share essential health information without fear of judgment or discrimination. Number 3, adopting inclusive practices. Inclusive practices in healthcare not only involve the physical environment, but also extend to interactions and procedures. Healthcare providers must refrain from making assumptions about a patient's sexual orientation or gender identity. For instance, adopting comprehensive intake forms that include various gender identities and sexual orientations can help in collecting accurate health data, which is crucial for effective treatment and care. Organizational level changes are also essential. Healthcare systems need to prioritize structural changes that support LGBTQ inclusive practices, such as integrating LGBTQ health concerns into the overall healthcare management systems and policies. This includes training all staff, not just clinical providers, on LGBTQ health disparities and affirming communication to ensure that every patient interaction is respectful and inclusive. In conclusion, through a comprehensive exploration of the barriers and strategies for LGBTQ inclusion in clinical research, this video underscores the critical need for more representative studies to ensure equitable health outcomes for all. The discussions reveal a multifaceted challenge, from facing discrimination and access issues to the necessity of redesigning studies to authentically encapsulate diverse identities. Emphasizing strategies such as the involvement of advocacy groups, modifying recruitment materials, and enhancing the education of healthcare providers, we chart a course toward a more inclusive future in clinical research. This is pivotal not only for the advancement of medical science, but also for the affirmation and respect of LGBTQ identities in healthcare settings. By reflecting on the broader implications of these initiatives, it's clear that fostering LGBTQ inclusion transcends mere participation rates in clinical trials. It's about fundamentally reshaping how research is conducted from the ground up to celebrate and include a spectrum of human experience. This path forward invites further research and action to dismantle existing barriers, urging a collaborative effort between researchers, healthcare providers, and the wider community. Such endeavors will not only propel the field of clinical research, but also empower the LGBTQ community, ensuring their health needs are understood, respected, and addressed in all facets of healthcare innovation. Thank you for watching our video, and we hope that you found it informative. Don't forget to like and subscribe to our channel for more content on clinical research.